Welcome to SkinCast, the podcast where we dive deep into the world of aesthetics. SkinCast is proudly brought to you by Seriderm, a leading distributor of advanced aesthetic solutions. At Seriderm, we're committed to empowering aesthetic professionals with the tools and knowledge they need for a successful practice. Each episode will bring you expert interviews, success stories, and practical guidance to help you maximize your ROI, achieve the best clinical outcomes, and keep you informed about the latest innovations. So sit back, relax, and get ready to unlock your practice with SkinCast.
Hey, hi everyone. It's great to be here again, and I'm joined once again by the wonderful Dr. Donna Freeman.
Thank you.
If you've followed us before, you already know that we're good friends, worked together for a number of years, and I managed to trick you into coming into this industry.
You absolutely did. I was fully on the path of becoming a chemistry nerd and writing up my doctorate, and I can actually remember it. I remember I'd done a couple of weeks temping at your company, and I'd only spoken to you on the phone, and you came into the office one day and you decided to tell me in salesman speak how this device worked. That it was this IPL device that used these little polymer strips to change the light output depending on the treatment you wanted to do. And after you'd given me the salesman's sizzle, I then said, well, do you want me to tell you how it really works now? Because polymer technology was my background, and you offered me a job.
And we offered you a job straight away to be head of clinical.
Exactly.
But the best decision we made there, okay?
Absolutely. I've enjoyed every step of it.
Yeah. We're here today, I guess I wanted to just do a brief introduction about this new exciting product which has been blurred out because we're just about to do the launch, and it's a new product for the treatment of active acne. It's actually an old product that's been redesigned. So I guess first of all, perhaps the first question would be, could you just give us a quick overview of current technology, starting from, we started from the basic blue light, people are using IPLs and people, so perhaps you could just do a brief overview of the traditional and the current devices available for treatment of active
absolutely. Acne. Yep, so going from the very simple at-home LED devices, notwithstanding the topical devices and topical treatments, etc. that are out there, but when it comes to energy-based devices, you see a lot of the LED masks, the things you have to use every single day. Blue light's very good, but only treats the very surface of the skin. Yellow light can get a bit deeper into the tissue. Red light obviously can get a lot deeper into the tissue, so has often been used to really try to get in there and improve the condition. IPLs. Now, the way that most of those are working is they're purely trying to kill off the bacteria that's there at the time of treatment. And why you need to have so many frequent treatments of them is 24 hours after you've had treatment, the bacteria is proliferating again and you're covered with it again, and it's going to cause a resurgence of the acne.
So with those devices, we know that you need multiple treatments.
Yeah,
and
absolutely.
You need to continue.
Very frequent treatments, yeah.
And then a recent one to come out has been there's a couple of devices on the marketplace with a wavelength of 1726 nanometer, and they are perhaps targeting the sebaceous glands. So perhaps you could tell us a little bit about that? Yeah,
so they take advantage of the fact that at that particular far infrared wavelength, you've got a preferential absorption into sebum. And preferential over melanin and water that's in the skin. So it means we can be a little bit more selective about just targeting where sebum is accumulating, which tends to be obviously near the sebaceous glands. And we know that for acne sufferers, they tend to have an overproduction of sebum that starts to cause the problem with the blocked follicles, etc., and allows the bacteria to proliferate within these blocked follicles. So those devices, by targeting the sebaceous glands and by suppressing or damaging those sebaceous glands, they can take out one of the aspects of the acne cycle, the acne problem. But they are uncomfortable. It's quite a thermal treatment. You do need sort of cooling with it, and a lot of patients do need anaesthesia with it.
Oh, and I recently, been seeing that product in the past. I was involved in that company, and I know it's, again, 3 treatments, but maybe top-up treatments. So you see that some people are maybe up to 6 treatments, and that you also then perhaps need to use topicals with it as well.
Yeah, I can imagine, absolutely, because it's addressing one of the aspects. As I say, it's just addressing to reduce down where there's that excessive production of sebum. But you're still going to need to be doing something to make sure those follicles stay unblocked, that you don't get the over cycling of the dead skin cells in the surface, and you're also going to want to try to get on top of the inflammatory condition as well, because acne is not just the presence of the bacteria in a blocked follicle, it's the reaction of the skin to the presence of that proliferation of bacteria. It's an immune response within the body, and that's something that a lot of these devices can't touch.
And I know, we're excited by this device, which we'll be revealing soon, and perhaps people will, after our podcast, you'll be able to see it online. And for me, it's exciting because we've been both involved in this technology for many years, and we'll explain that this is older technology that's been regenerated, and some of the new features which will go on to allow us to do multiple pulses, it's been upgraded a lot. And I was approached by this company 9 months ago to take over distribution in Europe for it. And you'll talk about the science behind it, because I'll let you talk about the science behind it. But for me, I said, okay, well, I know it was good before, because I've seen the evidence from my own side. We both lectured all over the world in this product, and it's exciting, okay? But for me, I said, okay, well, look, use it, let me have one for 9 months. I'll put it in with the chap who did the original study, which you'll talk about his results now, Ed Seaton over at One Welbeck, okay? And just I want to see, was it as good as before? And for me, it was really good that the likes of Ed Seaton being able to come back and say, Kevin, yes, this is as good as it was before. Yeah. And for me, that's all I needed to be as good as it was before. So perhaps you can tell us a bit more why this technology is so exciting, why it's so different, and why it's currently the best available machine on the market for acne at the moment.
Yeah, absolutely. So, we've absolutely worked with this for many, many years in the past. And it was originally developed as a wrinkle reduction laser. That was its first sort of FDA clearance within the rejuvenation world. At heart, it's a vascular targeting laser, but this one had very specific designed laser cavity that enabled us to really tweak that laser profile. And instead of damaging vessels, which you normally saw during a vascular treatment, we could actually just get fenestration of the vessels. We could just stimulate them enough to make them think they'd been damaged, and then they kick off the wound healing response within the body. And we saw amazing brand new collagen and elastin being produced as a result of using really very low energies on the skin, literally between 1.5 and 4 joules per centimetre squared.
And again, it's important to point out to people, because people will ask me about it on the weekend. This is so different. This is based on dye laser technology, but it's a very short pulse. And I think the key that people need to understand it, this is delivering bulk of the energy in 150 microseconds. This is so different from other.
Absolutely, yeah. All of the other pulse dyes out there, you certainly couldn't recreate the results with them, because they have typically a much longer pulse, and the shape of the pulse means that the majority of their energy is delivered at the end of the pulse, because they want to get thermal build-up in a vessel, and then they want to ablate a vessel. So they want to put that heat in at the end to cause that vessel to rupture. Whereas the new device has all of that, most of that energy delivered at the very beginning, give the vessel a little bit of a thermal shock, and then as it's getting to the point where it could be damaged, that's when the energy's tailing off. And so we're just stimulating. I
know the key technical difference is the fact that it's a much smaller laser cavity with 4 flash lamps rather than traditional lasers being single flash lamp with a longer cavity, and that can give us the rapid rise time. But I guess that we were together when it was actually discovered from Acne. If you can remember, it was a photograph sent to us by Malcolm Torres from London Day Surgery Centre. And I can remember phoning him and saying, Malcolm, yes, a great photograph. His wrinkles have been reduced. But he said, no, you're not looking at the main thing. All the acne's disappeared. And that was exciting.
Yeah, absolutely. I think he was saying that literally patients that had active acne at the time of coming in for their rejuvenation treatments were ringing up a week, 2 weeks later and saying, I do not know what you've done, but do it again because all my spots have gone.
And that's a far more exciting marketplace. I know then that we then did the obvious thing and put a machine on test, because I think maybe in recommendation from Malcolm and people to say, you need to put this in with Professor Tony Chu.
Yes.
So perhaps you could just talk us through why this is different, the mechanism of action, and perhaps touch on some of the clinical studies, because they are amazing landmark clinical studies.
Yeah, absolutely. Yeah, so absolutely. We put the device in with Professor Chu at the Hammersmith Hospital and Imperial College, and he did a full randomised control trial with the device. And it was actually, and I believe it still is today, but at the time it was the only laser that was ever accepted for publication in the Lancet Journal. That's how prestigious the study was and how exciting the study was back in those days. And basically he did a single treatment, and then he followed up those patients at 2, 4, 8 and 12 weeks afterwards, I think, and was seeing just amazing reduction in the number of active lesions within the first couple of weeks after treatment, and persisting for 12 weeks plus after treatment. I think I remember him saying this was one of the studies where he made a mistake, and he learned from a mistake in that in the first 2-week follow-up he brought both the placebo group who hadn't had the laser and the treatment group together in one waiting room for their follow-ups, and they all could pick out who was in the placebo group and the treatment group, and all the placebo patients were kicking off because they wanted the treatment.
I know, it was exciting stuff, and people can see the photographs online. But
in terms of what that study found out, as I say, really, really great results. I think it was something like single treatment, bearing in mind that this is just a few minutes to cover the face, single treatment, and even at 12 weeks, still had around about 60% of the patients had more than 50% resolution in spots. That's with no other skincare, not using any home care or anything like that. Now, they went on then to do some additional study work to find out exactly what was going on, because there was obviously some sort of immune response going on here. And I
think it was Ed Seaton took 2 years of his life to do this study.
Absolutely, yeah. Ed Seaton, who worked with Tony at that time, he then went on to do this work, and he looked at a few factors. He wanted to look at, were we reducing sebum production down? And his study work found no change at all to sebum production. Looking at the acne proliferation, looking at the amount of bacteria that was on the skin, and yes, a drop off after the treatment, but within 48, 72 hours later, that acne was all back again. And then he started looking at certain cytokines, certain chemical messengers within the skin, and some of them weren't changing, but there was a massive change in a very important cytokine called TGF-beta, transforming growth factor beta, and that is very important both in the response from a wrinkle point of view, so it's important for wound healing and producing new collagen, but when it comes to the acne skin, it's really important for down-regulating the inflammatory cascade that's causing the whole acne problem in the first place, and it's actually intimately involved in acquiring an immune response, so it's preventing future lesions from forming. So on the day of treatment, you've kind of got a threefold treatment going on. You are killing off bacteria with yellow light, which we know kills off the bacteria on the day. We are rejuvenating the tissue, and we're getting new collagen and elastin being formed to make that tissue as healthy as possible, perhaps even improve some acne scarring that might already be present, and then we are causing this massive upregulation of TGF-beta, which will suppress the lesions that are there at the time and prevent new lesions from forming.
I know there was and we won't go into the politics behind it, but there was a study produced many years ago with this particular laser saying that they felt it didn't work, but when we looked at that data, every patient had improved because they just done a relative spot count from one side to the other. And so what we discovered in that study, if you treat one part of the face, the rest was clearing up.
Exactly. It's a systemic effect, yeah. The mistake they made on the design of that study is they made it a split face. Yeah. And so the effect of treating with the laser on one side was actually having a certain amount of a systemic effect with the laser on the other side. So it didn't look as if there was a better outcome from having the laser, which again although it was a bad thing, it actually was a good thing. It enabled us to figure out that this is a systemic response from this device. So treating just a small area can actually have an effect across a larger area.
So I guess what we're looking at is different. There's 3 stages. Is the effect on bacteria, rejuvenating the tissue, which must have an effect on, I guess,
healthy tissue is going to be healthy tissue, isn't it?
And the third most important thing is just create an immune reaction.
That's it. That's it.
You'll see, like if you look online, and perhaps we can show it now, is we have some long-term patients. So the particular famous one was a part of a twins, and one of them had acne, one had never had acne, and we've seen those results 2 or 3 years later.
Yeah. Absolutely. Yeah, I mean, even, back when we were working with it, we'd had patients that had had their initial course of treatment. And what we would find for the average acne patient was that they were having their course of, say, 3 sessions once a month. And then they were being scheduled back in maybe for a maintenance session at 3 months, but at that time not needing it. It could be 6 to 12 months for some patients before they might need a little top up, depending on the sort of level of their disease. And then again, within 2 or 3 years of having the treatment, you could say people might naturally resolve, but you could also, argue that the continuation of having the treatment and improving the skin condition and down-regulating that inflammatory cascade has just caused the acne to naturally peter out.
Well, I can remember being in a waiting room in London Day Surgery Centre, and there was a young chap, he may be 21, and he had perfect skin. I can remember saying, "Why are you here for the acne treatment?" And he said, "It's so exciting." He said, "Since I've had this treatment, and my acne hasn't come back, and I'm not going to give it up." He said, "And I get the skin tightening effect,
Yeah,
I see my scars have improved."
It's life-changing results.
So that was quite exciting, So I guess one of the things that people would want to know is about return on investment, I guess, and obviously some of these other machines have high running costs. So typically, what are the sort of costs per patient with this?
Well, I don't know the exact cost, but I would say you're looking at below sort of £10 per patient per treatment. Very quick treatment as well. Very easy to do. No need for topical anaesthesia. No need for an external cooling adjunct device. So this is also a treatment that can be easily tolerated by teenagers as well.
Well, brilliant. And I've got a follow-up podcast coming with Sam, and she used to work at private clinics, so she's treated thousands
they
of
must
clients.
have treated, just
so
about the most.
We'll get her perspective in as well.
Fantastic.
So I guess, thank you, Donna, for today.
Thank you.
I know we're both excited by this product.
Absolutely.
I would keep in touch. If you want to find out more information, you can click on the link to find out more. But for me, this is an exciting regeneration. And just for you all to be aware, the machine is called Infinity 585. So look forward to the launch. And thank you very much for today.
Thank you.